you, sir. So this is, can I have my slides? So this is a TNOA free paper thing, comparison between two excisional goniotomy procedures, KDB versus BANG in mild glaucoma patients. So the KDB blade and the bent ab interno goniotomy is well documented for minimally invasive glaucoma surgery, and mild to moderate POAGs were taken into this study. Primary outcomes and secondary outcomes were the reduction in IOP bottles as well as the medication-free population. Secondary outcomes were the success and the failure rates. And that the World Glaucoma Association guidelines were taken into account to qualify as complete success, qualified as well as failure. And this is a prospective study which had a consenting consecutive patients during a 6-month period with 71 patients, and then a follow-up of another 6 months for them, and mild to moderate POAGs were taken based on the Humphrey or the Octopus. They were graded as mild or moderate, and based on the logistics, it was the patients who preferred whether they entered the KDB procedure or the BANG procedure, and along with phacoemulsification. It's an open label study with both the patients and the researchers aware, and the same surgeon did myself for all the procedures, and the follow-up was 1 week to 6 months, and gonioscopy and anterion was also documented in the post-operative period. So this is a surgical procedure of the KDB that was done. It was an inside-out approach, as you can see, a clockwise and an anti-clockwise movement on either side. And if there was a frill of tissue that was remaining, an ILM peeling forceps was just used to take the tissue out as a novelty. And this is a BANG procedure where a 26 gauge needle was used the same. Both inside-out was technique, inside-out was followed for both the procedures. Data analysis, a pair t-test was used for analysis, and the phaco KDB group analysis had an IOP drop of 22.83 to 16.25 at 6 months, and the AGM reduction was 1.16 bottles to 0.62, again only keeping mild to moderate in contention, and this was greater than 1 AGM bottle reduction, medication-free population, and the success rate being 72 complete success, failure of 13. Let's see the BANG group where a similar incident was noted, 20.28 to 15.01 with the mild spike at 1 month period, and the AGM bottles being 1.08 to 0.49 reduction in bottles, and the medication-free population of 50% at 6 months was slightly eye-catchy here, with a complete success of 48 and a failure of 26%. So let's just reboot or recompare. The path taken to the endpoint was slightly different, but more or less the drop in IOP was the same, with a 6 millimeter and a 5.27 millimeter drop in mercury between KDB and BANG. And the reduction of AGM bottles were quite same, where there was a 50% reduction of AGM. And the percentage of reduction in AGM bottles were also similar at 97 and 88. But the medication-free group was higher in the KDB group at 73 and 50 in the BANG group. And this is again the parameters of the age, the ratio, the visual acuity, and the confidence interval charting that you can see here. And complications, KDB microephyema was noted in a few, whereas in BANG there were some patients with choroidal folds which did not have any issue with the visual acuity, and 2 patients had a peripheral anterior synechiae that you can see here. So KDB in gonioscopy and anterion after 1 month to 6 months, there was a clear W sign that was noted with KDB, whereas with BANG there was some remnants of trabecular meshwork. Both the procedures reduced the IOP and the need for AGM in patients with mild to moderate glaucoma. But patients in KDB was performed, the IOP was comparable again, while the decrease in the number of AGMs was also comparable in both groups. The percentage of medication-free patients were quite higher in the BANG group. And the complete success rate of BANG remained higher than that of KDB, because the failure rate was quite high in the BANG group, and it was twice the high as the KDB group. Whereas the BANG group showed only a 48% compared to the 72%. And this one particular animation theory was one theory that I wanted to show it in animation, where in KDB there was a clean scoop of the trabecular meshwork without any reflets, depicting the W sign in anterion. Whereas with BANG, since the needle was not made for that purpose, surrounding additive tissue injury could be, or the trabecular meshwork leaflets were not clearly removed, and that could be also a precursor for PAS. And this is another extension of the KDB cohort, which showed that results were more promising in the long-term follow-up as well, without any injury to the surrounding tissues. So this is the KDB image as well as BANG. So to conclude, IOP was comparable, AGM reduction was comparable, but the failure rate appeared to be double, and the proportion of the eyes to reduce one or more AGM while maintaining the IOP less than 21 appears to be greater in eyes with KDB compared to the bank group. And future studies with RCTs are needed to have a much better conclusion. Thank you.
Dr. Prasanna, do you think this 6 months period of follow-up is sufficient to give any significant comments on this kind of a study?
Definitely, this is one of my studies I presented in the TNOA session last year, sir. Now I have a follow-up of 1.5 to 2 years, but I had to present the same slides. But the data that I have now with 1.5 to 2 years, again, those are pointing towards slight superiority of the KDB over bang, especially when it comes to excisional goniotomy. So this was one of the earlier studies in mix when not much data was available, sir.
Thank you.